So in this video, I'm going to go over why you would never get a Medicare Advantage plan and some of the tricks that some agents will tell you. Normally, I would never talk about other agents and how they fool you with different things, but because this year I've gotten so many phone calls that have told me, look, this agent, and a lot of times it's an agent that comes out to their house. For some reason, it's like the local agent thing, but they've told me, this is what this person said. They tricked me into signing up for this plan, or this is the only thing that they presented and it was a Medicare Advantage plan. So in this video, I'm going to explain to you why you should not get on a Medicare Advantage plan, and also some of the tricks that these people tell you when they go to your home or speak to you on the phone. My name is Brian Monahan. I've been a licensed insurance agent for the past 17 years. And I've worked with thousands of people explaining how Medicare works and trying to simplify the system. So let's jump into the video. So if you see on the screen, I have basically three different plans on here. In 2024, myself, this is just me, this is not everyone in my company. I'm only going to basically tell people about two plans. That's going to be Plan G and Plan N. Now, if you're not familiar with these plans, if you're turning 65, the first thing that you're going to have to do is get your Medicare A and B card, as you see on the bottom left here on the screen, John L. Smith. And that's going to cost you about $174.10 a month, which you're going to pay to the government. So you're going to pay that whether you get a Medicare Advantage plan or whether you get a Plan G or a Plan N or any of those other plans. So let's get that right out of the way. You're going to pay that no matter what. The second choice that you're going to have is, do I want a Medicare Advantage plan, as you see at the top of the screen, and then, or what do I want a Medigap plan with a separate Part D prescription drug plan and a separate dental, vision, and hearing plan, and so forth. So the Medicare Advantage plans, let's start with this. This is some of the stuff that I've heard, and I'm just going off the top of my head. There's no script. People have called into my office and I've spoken to them. The number one thing that they say to me is, this person never presented anything but a Medicare Advantage plan. Now, I guess for a lot of people, if they don't watch videos like this or they don't talk to anybody about Medicare, they can get fooled into going into a Medicare Advantage plan. These plans are very, very enticing. Now, I have said this in pretty much all of my videos. I'm originally from Philadelphia. There is one plan that I have over 100 people on that is a Medicare Advantage plan. This is the only plan that I would ever promote to anybody. I have people on other Medicare Advantage plans throughout the entire country, but it's because they called in and specifically said, this is what I want. You know, I don't want to get on a Medigap plan. It's too expensive in my area. I want this plan. Otherwise, I would have just said, find somebody else. But with the Medicare Advantage plans, the first thing that they do, if you look up at the screen, they entice you with a zero premium. Now, any agent that you talk to, and I would love to name names, but some of the agents that are on YouTube that you've probably watched, they know what I'm talking about. These are the guys that have been around for 15, 20, 25 years. Specifically, another guy, I hear him talk about this a lot. This was never around, the zero premiums. What happened was years ago, 15, 20 years ago, I think they were zero premium at one time, and then they kept going up by $25 increments. So one year it was $25, then it was $50 for the same plan, and most people just said, well, $25, $50 a month, I can afford that. But the problem was, after the 2008 crisis, most of the people, the plans had gone to $100, $125 a month. Myself, I spent most of my days going and sitting with people and switching them. Literally, I would walk into their house. I don't do this anymore, but I would walk into their house and they would say, I got to get off of this Advantage plan. And I would start writing on a piece of, on an application for a Medigap plan. Back then it was Plan J and Plan F. Most of the people were getting Plan F and just get me off of this thing. But then somewhere around 2014, I remember they started rolling out these zero premium plans again. They figured we got to get back to this or nobody's going to want to buy these plans, which they were absolutely correct about because they were not as good as the Medigap plans. So the premiums, if you see here, are now zero. This is the first thing. How much does it cost? It costs nothing. Now I'm going to slide all the way down to this maximum out of pocket, because I've heard this. I heard this last week from somebody, and this is the biggest foolishness that I've heard. So they say, well, the maximum out of pocket I can spend is $1,550 or $1,000 or $3,000. If that maximum out of pocket is not $7,000, $8,000, I know that not only is this plan not going to be accepted at many places, people say to me, well, this is a PPO plan, so I'm allowed to go anywhere. Yes, you're allowed to go out of the network. But here's the thing. The doctors do not have to accept you if they're outside of the network. And they're not going to accept you outside the network. So I get the phone calls from people saying, hey, I thought the maximum out of pocket was $3,000, but then I wanted to go to this doctor, I wanted to have this done at this hospital, and I found out I can't go anywhere that I wanted to. That's trick number one. You're not able to go where you want. Doesn't matter if it's a PPO. That doesn't mean the doctor is going to take you. Now, if you look at the Plan G and Plan N, the only question you ever have to ask with a doctor or hospital is, do you accept original Medicare? And if the answer is yes, by law, they have to accept any Plan G, any Plan N that is out there. So most people want to look at different companies like AARP, Humana, Cigna, Aetna. These are the big companies that people have heard of, which is great. It's fantastic. You want to go with one of those plans, that's great. But it doesn't matter the Plan G or the Plan N's name. Someone could take your card, rub off the name, scratch off Aetna and write Cigna on it, and it would be the same exact Plan G. That's number one. But let's talk about scam number two that people don't tell you about. So they try to slip in the fact that it has dental, vision, and hearing and prescription drug coverage attached to it. Now, a lot of times the prescription drugs are good with these plans. I have nothing to say about that. But the one thing I've heard about the vision, dental, and hearing is that the networks are very small. They can't find a dentist in the network that they like. They go somewhere, the person doesn't speak English. All these types of things happen when you go into a Medicare Advantage plan and they are able to tell you where you need to go. One of the biggest things about the Medicare Advantage, and I'm having problems right now because I have my Medicare supplement clients that are unable to switch out of some of their plans because of underwriting, is that the skilled nursing for Medicare Advantage is only 20 days. For Medigap plans, as you see G and N, you get 100 days. Now, a lot of people will say, okay, 20 days of skilled nursing, that's a lot of days. That's pretty much 3 weeks of skilled nursing if I have a surgery, if I get my knee done or something like that. But I've had clients, and a lot of these, once again, agents that have been around for 15, 20 years, have had clients that have had strokes and major things like this. 100 days is what they're going to need in skilled nursing, and they're going to want to go to the best skilled nursing center possible. I actually had someone who had a mental breakdown because I think it was her sister had passed away, and she went into the psych end of the hospital, ended up being in skilled nursing for that. She was there for 3 months. And so this was very important, because if anyone knows anyone that's had a mental breakdown like this, you pretty much need 24-hour care because it's so impossible to deal with what's going on in your head. And so this was extremely important to her, and that's just one of the examples. I've had people that have had strokes, all sorts of things, even just simple operations where they went to bad skilled nursing afterwards, and it was a nightmare. So be careful of that. Another thing that they will say is that the CAT scans are $100, or that the primary care physician is a zero premium primary care physician. Yeah, that's great. But the other thing is, how much is it in the hospital? And if it's under $250 or $300 a day, what hospitals can you go to? Because you have to look at the fact is, if it's more expensive, the network's probably bigger. If you're getting these oh, it's only $100 a day in the hospital. The maximum out of pocket's only $1,500. The network's going to be smaller. But let's jump over to, especially if you're turning 65, Plan G and Plan N. Now, if you look at these two, your premiums are going to vary. And I've done other videos, and I'm going to address some things about the comments and the phone calls that I've gotten about my other videos. Some people say you like the Plan G better than the Plan N, which is untrue. But I guess I came across that way in certain videos. Some people say you like the Plan N better than Plan G. Same thing, it's untrue. I might have come across it that way in that specific video for some reason. Maybe I stressed that you could save money over here, or this one covers more, whatever it may be. But these are the only two plans that I am going to give my entire, whoever contacts me, my clients in 2024. There could possibly be Medicare Advantage plan, but I'm not, as far as plans go, Plan G and Plan N. And I don't know what company, because I'm licensed in 48 states, and Humana could be the least expensive G plan in that state, or it could be Cigna. So I give choices to whoever calls me, and if they want my opinion about a company, I'll give it. But I also let them know, here's what's out there. And here's another thing. Things changed. Every couple of years, well, every year we contact our clients and let them know the different plans and how much the new cost is going to be for the premium. So most of my clients switch every 2 years with their Plan G or their Plan N, 2 or 3 years, because we let them know, hey, you're paying $180, this one's $140. It's the same plan, just a different company. And so we constantly are switching people, saving them money, and getting them the same coverage or better coverage, whatever it may be. But the tricks of the Medicare Advantage, especially during the open enrollment period, people have to beware that a lot of times once you get into a Medicare Advantage, 2 years later, people call my office constantly and say, I want to get out of this plan, especially during the open enrollment season, October 15th through December 7th. And they can't get out. Something's wrong, and they cannot pass underwriting. And so it's basically a wash. Now, is it the end of the world? No, they're just going to have restrictions. And some people who want the best care, they don't want those restrictions. This is a short video. Thanks so much for watching. I'm going to go over Plan G and Plan N in depth. I do it in most of my videos, but I'm going to do it this week in some of my other videos to show you just how great these plans are. Once again, my name is Brian Monahan. Thanks for watching. There's some links in the description box below that will have my book down there, which is free. It goes right to my website. You can read it right on the website. Don't even have to put your email or anything. And also some different videos that you might want to watch. I'll see you at the next video.